Across our communities, myths, stigma, and misinformation continue to affect the health decisions people make every day. That is why Reach Out Health Awareness Foundation, ROHI, brings you Health Connect Forum, a public health education program created to inform, empower, and promote healthier communities through accurate and practical health conversations. From mental health and maternal care to disease prevention and community well-being, Health Connect Forum brings experts and communities together to address the issues that matter. ROHI invites health partners, organizations, corporate bodies, and individuals to join this movement through sponsorship, collaboration, and participation. For more information, visit www.rohi.org, call 0703 044 8318 or 0813 973 0664. Health Connect Forum, powered by ROHI. A very good morning to you and welcome to Health Connect Forum. This is where we bring the experts every Wednesday. Well, this morning our guest is Dr. Angus Ikpe. I hope I got that right this time, Doc.
Sounds like Cross River. It's Ikpe.
Ikpe?
Yeah.
Okay, good to see you again, and you're looking good.
Thank you. And you too.
Thank you. Welcome wherever you are. We're broadcasting live on Municipal 95.3 Abuja and Amak Community Radio in Karachi. Welcome. Health Connect Forum is a public education program brought to you by Reach Out Health Awareness Foundation, popularly known as ROHI. We bring trusted experts weekly to help Nigerians make informed health decisions. ROHI also runs free community health talks and BP sugar screening every last Saturdays at the Gwarin Power Market. So if you're at that part of town, do well to join us. For professional medical support and health advice, once again, call 0800 001 98812 or send us a WhatsApp message to 0802 235 3713. All right, today we address a worrisome trend many families face due to rising health costs. Well, increased self-medication through unverified health advice and drugs obtained without prescription. Well, make we talk true. Body no be firewood. I trust you must have heard that. But that doesn't mean we should actually swallow anything anyhow. Well, with economic pressure, many Nigerians now buy quick 500 naira mixes. You must have heard somebody say, go to the chemist, tell Oga chemist, make you mix medicine. Yes, from unlicensed vendors, or follow health tips from social media influencers on TikTok, WhatsApp, you name it. Well, according to NAFDAC's 2024 report, over 60% of drugs in circulation are unregistered or unregulated. Consultant nephrologists also report more Nigerians aged between 25 to 35 presenting with early kidney damage linked to misuse of painkillers and herbal mixtures. A simple headache should not damage your kidneys. So, how do we balance survival in hard times with protecting our long-term health? Big question. Joining us, Dr. Angus Ikpe. Well, in case you didn't know, Dr. Angus is a public health expert. Doc, thanks for joining us once again. Because of time, we'll just go straight into it. We'll put the spotlight on economic reality and medical impact. Well, let's start with economic reality. Healthcare cost has increased. Whether you believe it, whether you like it, many people feel that they have no choice. From a medical point of view, what exactly happens when a person regularly walks into an unlicensed vendor shop and asks for a random drug, some people call it mix, for pain or infection without prescription or a dosage guidance?
Thank you, and good morning, listeners and viewers. Okay, so first of all, let me just jump on your statement about healthcare costs. Of course, cost of living is very high in Nigeria, but let me also just mention that healthcare cost is cheap comparatively.
comparatively.
Yeah, in Nigeria compared to other places, So now the issue of people walking in to just get a mix of it's out of convenience, right? It's also out of the fact that everybody sees expenditure on healthcare as a waste. So if you can cut down the cost, better. And another reason is the fact that time it takes you get to the hospital to see your GP, wait to see him, get your drugs, and get back home. That could cost you about 3 hours. But for convenience, you just go to the nearby chemist shop. And of course, those people are always ready. They have all their stuff. Their staff, maybe unqualified, And so now the thing is, you don't know what you're taking, okay, because you have unlicensed persons giving you medical treatment. It's something that you could actually put back on government in terms of regulation, right? Because people who are not licensed should not be allowed to, practice, this health services, providing health service. So they shouldn't be involved. And when you take medications from these persons, all the dangers of the drugs that you take, because you don't know what you shouldn't be taking, you don't know what can harm, because first of all, there are medications that are meant for human beings, but the problem will now be, are you taking the right medication? Are you taking the right dose? Right? The combinations, are they a problem? Because all of these things is what the pharmacists and so on tell you when you go to and then looking at also what you may react to, right? So now the for many of the drugs, they are, like I said, they were meant for humans, but when you take them in excess, that's where the danger comes. Now, for the aspect of the painkillers and the damages and so on that can, some of them also have their over-the-counter dosages, and that's what a lot of these chemists are allowed to sell. Okay, but once it gets to prescription drugs, like you have to have a prescription. For instance, a simple drug like ibuprofen, the 200 milligram dose is out as an over-the-counter. You can buy. You don't need a prescription for that.
Okay.
But 400 milligram, which is double, is a prescription drug. So, but I mean, all over the chemist shops, we have everything that you find in hospitals, what you find in pharmacies and so on. So it's actually not a good thing, because you're going into something that you don't know about. You don't exactly know what they're giving to you, whether it's safe. So it's a safety issue.
From what you are saying, what I see is someone walking into a pharmacy, as I said earlier. In fact, let's not even say pharmacy, a chemist.
Yes, chemist.
In common parlance.
That's
a chemist.
Because,
and then you don't know what
vendors.
they are mixing for you. You just say, give me something for my body, they pain me. Mix medicine for me.
Yeah.
So you don't, now you sound knowledgeable. I mean, this is your tough. But for the ordinary man in the street who doesn't know what is in that mix, what danger does this portend?
That's why I told you it's just all about safety, all right? You wouldn't go eating what you don't know, for instance, although that one, you judge it by taste and all of that. But what if you're eating something that, like mushrooms that are dangerous mushrooms that are inside? And so it's about your safety. You should know that you shouldn't get healthcare that way, because, I mean, you're putting yourself in danger. That's what it's the safety issue that is the main problem here, because the people you're talking about are unlicensed. Would you ask someone who has no certification at all to go ahead and build a skyscraper? Because you're taking a lot of risks, and then you could get some very terrible consequences from what you're doing. But I mentioned that it is convenience that gets people to do that. And sometimes, we tend to lean towards the behaviors that ease our, stress and so on. So in such situations, you need strong regulation to ensure that you don't have access. Same problem we have with alcohol and some of these things. So there are rules about when you should be able to access alcohol, what time of the day, what places, and so on. But these things are not But you go to certain other settings, and you find that the regulation is stronger.
Is that stronger? We'll come to that hopefully. But let's look at this simple phrase. A simple headache shouldn't cost you your kidneys. You may have come across that phrase. To a layman, it sounds like an exaggeration. So if you will walk us through the physiological reality, how does a cheap everyday, let's say 500 naira painkiller mix or an unstandardized herbal mixture, it's popularly called agbo, how does it physically destroy a young Nigerian's kidney in silence?
Okay, I heard you, reel out some statistics about what the nephrologists say and what NAFDAC says and so on. So, I mean, that is correct. But, in science, you need to make sure that there's the evidence that really supports the fact that the majority of the kidney problems you have today as a result of painkillers. Diabetes, hypertension, they remain one of the top causes of kidney failure till date. So we know the young ones are abusing drugs. Of course, when they take some of these painkillers in order to help themselves, whatever, they overdose. So when you take certain drugs, continuously, persistently, of course, you're going to have sort of assault the kidneys. The kidneys are exposed to what is harmful. A little bit of these same drugs, like I said, they were made for humans to take. A little bit of these same drugs are taken by all of us. They are prescribed and so on. But imagine a situation where you continue to expose you. In fact, that is even how we tend to experience things like cancer. When a harsh chemical continuously gets in contact with the body, even if it's just for the whites who have less melanin, it's just the sun. After a while, there's a tendency for it to cause harm. So you have those things that they call in medical, we say they're nephrotoxic.
Okay.
They can damage the kidneys. But for instance, the drug called gentamicin?
I'm not familiar.
Okay, gentamicin is given often to treat certain serious infections, right? And we give it in hospital, prescribe it every now and then, but it can damage the kidneys. And so it depends on how long you've given it, what doses, what frequency. So by the time you keep hitting the body with exposure of something that is toxic to the body, you will eventually get damage. But if you take that thing according to what science has said in a safe way, 5 days dose and that's it, you don't prolong it. So for you mean an abuser of a drug, what's going to happen? Persistent exposure, and you will certainly get damage.
So that
would be the mechanism.
Okay.
Because of persistent exposure of something that has the potential to damage the kidneys, the end result is going to be, the tear that you will see on the organs. Yeah.
Okay. Another critical point we would have to touch in the course of today's program. Millions of Nigerians now get their medical advice from self-acclaimed health gurus on social media. Are we dealing with an entirely new breed of medical malpractice, or is social media just amplifying old habits of self-medication? You know what the trend is currently?
Yeah, I get to hear about it, even though I'm not always scrolling. The thing is, health messaging. It's not really like medical practice. Okay. So if you give me wrong health message, I'm not sure anybody is going to come after you. What I mean, I'm listening to you and you give me wrong medical advice. Even on this program, I could say the wrong thing, but I'm not sure it's going to put me in trouble.
Okay.
But if I give you the wrong treatment because I didn't follow the protocol, I'll probably get into trouble. So that's
what is the difference?
The difference is that the health messaging is not quite medical practice.
Okay.
It is part of medical practice, but so I haven't come across the regulation of health messaging that says before you put out this message, right, you must clear with social authority.
Or you must have this
license or this to be able to message. So that's where you're having issues, right? But I mean, all of us understand that we need to listen to the professionals, those who are licensed, to take care of. So credible, even the AI that gives you a lot of information today, they still tell you that AI can make mistakes, right? So there has to be a disclaimer to say, look, this thing you're because if at the end of the day you actually cause trouble and someone takes you to court, that's where you can now be. There can now be issues with it. So you see a lot of the smart social media influencers will probably put up a disclaimer.
Okay.
In order to avoid trouble.
Any issues.
But the fact that they just made the statement, it is when the statement gets to cause harm, and then you are in court, that's when you probably be having issues. So the regulation is only when there's an effect.
So because of what is happening currently, people are looking for alternatives. Keeping in view the increase in the cost of living, as you said, but we're narrowing down to health.
Yeah.
Do you consider these online vendors of all sorts of herbal mixtures, all sorts of medical advice, suddenly everyone is now a dietitian on social media telling you what to combine, what you must eat in the morning, drink in the morning and at night and all of that. Do you consider these set of people dangerous?
My answer to that is certainly all of those who are not professionals are likely to give information that isn't correct. So would want to be, but this has existed over time. People it's actually up to them to decide who they want to listen to and who they shouldn't listen to. But of course, if the health authorities get to see that someone is, dangerously, advising the public, they should actually, make efforts to try and stop it, because it's going to have some effect.
Indeed.
So it's not something that should be overlooked, but it has happened everywhere around the world, where you choose who you want to listen to. People tell you all kinds of things about food. What are you going to do about a situation where somebody tells you turmeric does this, this other one? Some of these things are unproven. And there are people who continue. So because they are not quite medical practice, right? People are free to say what they want to say. So the advice is all over the place. But I think people are also aware that they need to listen to the right set of people. But there are always those who are there to deceive people, maybe for the other benefits. For social media influencers, I think they're looking for traffic.
Basically.
And then they jump on this because they feel that people always have these needs, and so this is an area that they can cover and continue to get the traffic. So the aspect of regulation, there's so much. There isn't a better mentor today than AI.
Okay.
So I think that the availability, because one of the reasons why these things are also, when there are gaps, when the health system isn't saturating the population with the right health messaging, you're going to have all these other people come in and provide the communication services that so. But today that you have AI as a mentor, I said my dad is late, but I used to say one of my biggest mentors. So I used to tell people that you don't need your dad anymore. You don't need anybody. AI is just the mentor, but you have to be careful. AI is not often accurate. AI doesn't have the reasoning capacity. So where AI is a mentor, what makes AI a mentor? Because it has good information.
Quickly, let me ask you this question. Between the Agbo seller somewhere along the street, the online social media health influencer, and AI, who would you recommend I speak to?
Certainly. Those other two are not options, right? The Agbo person, first of all, traditional medicine, largely unproven. Largely unproven. So what we're doing now within the health system, the health authorities, is to try and make sure that we advance traditional medicine to be something reliable.
Okay.
Because that's also going with providing the evidence. So there's a lot of R&D in that direction. But largely, what is practiced, what is done today, and I can tell you, some of them are quite smart. What do? They know the orthodox medicines and how they help you. So, for instance, you have ulcer pain, so I take antacid, put it into a black other mixture that is black, and I tell you this, and the antacid is supposed to cost you 2,000 naira, but my black mixture is selling at 50,000 naira. So it's the same orthodox medicine. So it's going to give you some relief. So you're going to believe in it. but you're going to spend a lot more. So that's not that's fraud.
Okay.
Do you understand? So a lot of traditional medicine is fraudulent, right? You may see some relief, but especially for those who have taken advantage of the orthodox medicine that exists. So traditional medicine, like I said, is largely unproven, but we're developing it, and hopefully in a decade or so, there will be a lot of difference.
Hopefully.
It will. So for the social media influencer, definitely they are not professionals. But with AI too, everybody tends to be looking at what they need to say, and so maybe that's helping the situation. Maybe I would say, in the absence of nothing, a good number of them will be. I won't say a good number of them. So let me not recommend them.
Okay.
But some may be correct.
Some
may be
all.
correct. But for AI, as per information, AI is it.
Information.
Yes, but as per decision making, AI is not as reliable. It's overhyped.
I want our listener to get these gaps, these stop gaps.
Yes.
AI,
Yes.
good. It gives you information.
Information, yes. It has
Decision-making.
more information than myself, than anybody, because it's been trained on these things. But in order to piece this information together and make a decision, it doesn't have the reasoning ability that we expect. It appears to be reasoning, but it can completely fumble. It gives you very nice layout of stuff, but you'll be shocked if you're an expert. If you want to test AI, go to your area of expertise and ask AI to work with you. And you discover that its decision making is quite poor. But it tends to, in very simple decision making where you too would probably reason it if you have the knowledge. It will give you the result. But once it goes complex, and we get excited when AI is able to save us time in dealing with complex problems, but it can completely go off track.
I agree.
Even the best of them, even the highest subscription that you pay for. Yes, so it has limitations.
Okay.
But information, super.
Quickly, in all fairness to our traditional medicine, do you see a possibility where in the nearest future we can evolve into something reliable and consistent? I like to remember the fact that as children, your mother could mix one or two for you and get some small medical concern taken care of almost permanently. And it worked. And it was as if all our mothers back then went to the same medical school. They all knew these things, they had them at their fingertips. What do you see as a future for our traditional medicine?
Okay, I used to say when I was training that healthcare starts from what you can do for yourself onto what the family around you can do, which is your mom and others. Your dad. I'm one of those who had treatment from my dad that used to work. Malaria is a very common thing. So I got to know how to treat malaria with chloroquine from my dad back then. Okay. Although he was a health not a doctor, but so it was a common thing, So, but today what we have is either it's prescription drug or it's over the counter. Okay, so if it's over the counter, you're free. So there's some level of knowledge you should have. There's some things you can do for yourself. You should be able to get over the counter drugs to help yourself. With but for all other things, you need to see a medical professional, and then you get diagnosed. Okay, and then you get treated. But on the side of traditional medicine, like I said, largely unproven today, largely fraudulent today. Okay, but there's a lot of WHO guidance on helping countries develop their traditional medicine, because that's an alternative, and it's supposed to be cheaper for us because the all of the things that we use to deliver healthcare services in the orthodox way, they cost money. But traditional medicines should be cheaper. That's one of the reasons why WHO pushes for countries to develop that sector for themselves. So that's the alternative to orthodox medicine. And we expect there's a whole department of traditional alternative and complementary medicine within the Federal Ministry of Health, and they are working with the WHO to advance, do the research and development that will take us somewhere. So there's that interest in trying to develop that. So China, India, all of these places, they already have this area developed, and it's useful. But like I said, you need to solve the problem of the fact that there's a lot of fraud today and unproven stuff. So who will bring in the research that will help us get us there? That's where.
Facts.
Okay.
All right. Well, we've been discussing unverified online health advice versus unlicensed drug vendors, the growing risk of self-medication in Nigeria. We'll take a short break, and when we return, we'll advance this conversation. Don't go anywhere. We'll be right back.
Across our communities, myths, stigma, and misinformation continue to affect the health decisions people make every day. That is why Reach Out Health Awareness Foundation, ROHI, brings you Health Connect Forum, a public health education program created to inform, empower, and promote healthier communities through accurate and practical health conversations. From mental health and maternal care to disease prevention and community well-being, Health Connect Forum brings experts and communities together to address the issues that matter. ROHI invites health partners, organizations, corporate bodies, and individuals to join this movement through sponsorship, collaboration, and participation. For more information, visit www.rohi.org, call 0703 044 8318 or 0813 973 0664. Health Connect Forum, powered by ROHI.
All right, thank you for staying with us. This is Health Connect Forum. We're broadcasting on Municipal FM 95.3, Abuja, and Ama Community Radio, Karachi. It's been an interesting conversation today. My guest, Dr. Angus, who is a public health expert. Together we've put light on today's topic, which is unverified online health advice versus unlicensed drug vendors, the growing risk of self-medication in Nigeria. You want to join the conversation? Send us a message via WhatsApp to 0803 059 6162. Once again, if you have a comment, a question, you want to join the program to share with us, do well to send us a message via WhatsApp. Do not call, just send a WhatsApp message to 0803 059 6162. And our guest here in the studio, Dr. Angus, will do justice to your contributions. Remember, for health advice and support, you can call the number 0800 001 98812. or send a WhatsApp message to 0802-235-3713. The program Health Connect Forum is brought to you by ROHI, that is Reach Out Health Awareness Foundation. You can visit our website, www.rohi.org, that is www.rohai.org. Let's get back to the conversation this morning. Dr. Angus, let's touch briefly on the issue of regulation. What possibilities do you see there in terms of regulation, whether online or the agbo seller, the traditional medicine dealer who is operating unlicensed, unregulated, unsupervised?
Yeah, so, when you want a health system that works, when you want a healthy population, one of the key, approaches is to influence the behavior, the health-seeking behavior of people, and then the behavior of providers. And you do that through a coercive means or a persuasive means. Coercive would be regulation.
Okay.
And regulation is necessary, especially when people tend to go the opposite way. There's a greater tendency to move towards what is pleasurable or avoid what is painful. Okay? So what drives a lot of these practices, it's also the interest in making money, traffic for influencers, and so on. So it's a big opportunity, right? And the regulation that should happen, especially, is on the side of providers. to make sure that nobody is allowed to go ahead and be providing the services. But look at the situation where the patent medicine vendors, who are the chemist people, right? They know the rules on what they should sell. For instance, they shouldn't have prescription drugs. But without prescription drugs, they won't sell. So somehow they just keep selling, and that regulation is not strong enough, right? There are many other factors that affect the ability for the authorities to regulate adequately, right? First of all, when you match the organization with the population or the amount of the problem that you see, the amount of police officers or policemen that you need to be able to bring down crime within a place. It will almost take something, maybe half that or a quarter of that to stop, because the pharmacies, the people, and these places are littered all over the place. So I'm not sure the regulators have all of the resources and manpower to deliver and to ensure, because for instance, you come to Abuja and you probably have only 100 policemen. What's going to happen?
You can't deploy them to go and start checking.
They cannot
pharmacies.
deliver on securing Abuja, because 100 will not be enough. Okay, so that's the main point about regulation. But it's a big opportunity. It's one of the best ways to ensure that the system works. Strengthening regulation. So, and regulation has to do with the judicial system. It has to do with the enforcement system. It has to do so. And Nigeria, as a country, we have issues around judicial enforcement. There are weaknesses in all of these settings. All of these things are helping to affect the regulation. And then financing. If an organization is set up as a regulator and an enforcer, and they're not well funded, so the money we have doesn't go around everybody adequate, as in enough for everybody. So these things are also a function of the country's economic level. Some professor in Harvard says not all good things are affordable to poor countries.
Not all good things
are affordable. So sometimes we're too ambitious. We want state of the art. We want this. How much does your country have? You can't get it like you have it in the UK. In fact, you can't even get it like you have it in Brazil. The UK and Brazil have the same kind of financing system where health services is free. You pay from taxation.
Okay.
But in the UK, standards are so high. In Brazil, standards are not as high. But Brazil's GDP per capita, their income level, is far higher than Nigeria still. So even if you want to say, let's pay for health services from tax, we can't get the standard that Brazil. We did a cost analysis to know what if we decide to go for UK type or Brazil type of funding for healthcare. It will cost us 40% of our entire GDP, all the money we have, not government money alone, my money, your money, everybody's money put together in order to fund 40% to get Brazil's standard of healthcare. If it is the UK, it's all the money we have. It won't even be enough. Every single thing Nigeria has will be needed to fund, and it won't be enough to get half the standard that the UK provides to its population.
So, Doc, let me bring you back to Nigeria. In the face of all of these challenges,
yes.
First of all, what red flags in the immediate, what can we look out for? Whether it's with herbal traditional medicine, whether it's on social media health advice, what red flags can we look out for to at least begin to help ourselves first while we look at the long-term plans of the government?
So I think I'll start with traditional medicine.
Okay.
Because it's not well regulated for now, I would advise that people don't even listen. It's very fraudulent. It's largely unproven. It's not regulated as such, largely unregulated. Efforts are being made. But this is an area where my advice would be, don't listen to any traditional medicine person, because you're likely to be getting dubious information. The target is always your pocket. No other reason why they are there today. Okay, so the real traditional medicines they are still working on a lot of things. There are some things that have come up. There's this organization called NIPRIT, the pharmaceutical research organization. So they there are lots of things they're working on. Like I said, regulation, they're working on it. So but for now, my advice, based on my understanding, is that avoid listening to them. Don't even bother.
Okay.
The amount of reasonable stuff you get from them is insignificant. For the social media influencers, a lot of them are just so. Maybe they'll be giving you some kinds of advice or that, but it's likely because the way people talk about people also are misinformed, and even to this age of abundant information, they wouldn't go and make sure they are well informed before. The smart ones are actually researching before coming to talk to you. But what we say is that solutions in healthcare should be based on evidence.
Okay.
It's the reason why I didn't quite just jump on, the fact that, your 500 naira mixture exactly just leads to kidney damage. The people who are having the kidney damage are the abusers of drugs. Abusers of drugs are not mixing. They get these drugs on their own and they keep using them for some other benefit. Right? So that's the way. So everything they are told, information, do like this, don't eat this, take cod liver oil every day, it should be based on evidence.
Okay.
So, and where you like
that
to get...
the social media does not provide.
Social media does not provide... Yes, of course. No, I mean, you need credit, even people on their own tend to know who to listen to. Although, like I said, a lot of people will be deceived because an influencer is powerful, right? So, and the government too should also listen to them. If they think that anybody is dishing out dangerous information, the person should be stopped.
Okay. Now, let's talk about this. Low-cost alternatives. Do Nigerians have an option?
Very much so.
Tell us about
Maybe
that,
not an option for the poor. Okay, let me start with this. They say health is a right. It's a fundamental human right. It's not a privilege to be purchased. That's what WHO says. So every Nigerian has a right to be healthy. But that right will appear that you don't get money. Why are you saying you have a right to be healthy? But the truth of the matter is that you don't have money. It is government's responsibility to take care of the poor and the vulnerable.
Dr. Angus.
Hold on. I need to continue with that. Okay? So, first of all, those people who can't afford at all, they are government's business.
Okay.
Right? So, government is responsible for them.
Is government taking care of that responsibility?
Government doesn't have enough money. This is the dilemma.
So what should the Nigerian
It's a fundamental human right. So government is supposed to take care of those people. So, but let me still shift a bit. Okay, so there's vulnerable group fund under the National Health Insurance Authority. There's the Basic Healthcare Provision Fund that the government Ministry of Health is also handling. They're trying to ensure that the basic minimum package of health services are available for everybody. It's not even selective. Every health center should have a minimum of this provided for everybody, but the money, of course, cannot go around. But for the health insurance, there's a what's it called? There's a benefit package that is considered sufficient to keep you healthy. So the question is, for those who are vulnerable and poor, cannot afford, where their expenditure will lead them into the suffer catastrophic health expenditure, those ones, government has it's government's choice. So if you say a very poor person, government they are the what's it called? They are responsible for that
government
person.
Property.
Now there are a few of us who afford small monies. We make small monies. We're the non-poor, but we're the informal sector.
Okay.
Right. So when you go to hospital these days, one hospital bill, if you're admitted, is about 200,000.
So a lot of Nigerians are avoiding going to hospital.
That is the point. So if you're admitted in a private hospital, the average hospital, as in the small hospital, 200,000. All right. If you go as an outpatient, you're likely to spend about 50,000 naira. But there is insurance that pools money, prepaid, funds for health from you, who has a lot of money, and then they tax you. Okay, so based on your income, they collect your money. You're paying maybe 500,000 a year, but you don't. You've been behaving well. You don't do things that put your health at risk, and you're healthy. Your 500,000 is used because you hardly go to hospital to cover the man who is paying only 5,000 naira, or maybe there's no payment like 5,000 naira. Maybe there's 30,000 naira, right, for the year. So you pool these funds. So there's risk pooling. Your risk is low. The other person's risk is high. You have more money. The other person has no money. So put it together. That's insurance. And there's something called the Group Individual Family Health Insurance Health Insurance Program, GIFSHIP, under the National Health Insurance Authority. That program has a benefit package, right, that gives you, that cost about 38,700 naira per annum. And with that, you are covered. You are sure that all the basic things. No, see, it's beyond, because it covers primary, secondary, and tertiary. Okay. But it won't cover everything. But that level of cover is enough to keep Nigerians healthy.
Doc,
nobody stops anybody from going online now and registering and making your payment and having access to health care.
Exactly. I want to point us to the next steps. What you are saying now, a lot of Nigerians are not aware that these services exist. That's where this all boils down.
They're beginning to hear about health insurance, but probably not fully understanding how it works, because there are various packages. Federal Ministry of Health, or rather, federal government is offering through the National Health Insurance Authority. State governments also have some of their own packages. That some of them are cheaper. The 38,700 is the federal one, but that's more robust because the risk pool is bigger. It's able to absorb. So any smart person will plug into that pool that is able to absorb, not the one that will run out of funds. The smaller the pool, the higher the risk of not being able to cope. So the larger the pool, the better, right? If your foundation is pushing for people to, I will advise that they go for that larger pool. All you need to do now is monitor people's provision of service, how they get the service. Because for that pool that has the capacity to absorb, all you need to do is just make sure that the providers, the HMOs, are delivering.
Doctor, if I allow you, we will start discussing health insurance. So we would like
But that's the solution.
We would like to have that
That's
as a program on its own where we can focus and explain this to our people. So for today, assuming I'm listening to you right now and I have a need for medical or health care, where should I go? What should I do? If I need health insurance, if I fall within that bracket, what are the next steps? What should I do now? Is there a website? Is there a federal medical center?
Just go to the National Health Insurance Authority website. If you're in the particular, if it's FCT, you want FCTs, just these days, just ask. Google is no longer, I must find the exact website. Just say what you want to say. I'm looking for health insurance. I want to buy health insurance. I live in so and so place. Google search is now more of AI. It will just quickly bring you to the options. I want to buy health insurance. I'm tired of going to hospital and spending a lot of money. So I want to buy health insurance right now. It will take you to NHIS site. It will take you to, if you're in Lagos, take you to LASMA, their health management agency. They have their packages that you buy. FCT also has its own, health insurance program, where you also have their own premium is about 22,000 or something. So you just pay, and I know that if people pay because they now have a health problem, that has it's no longer the principle on which health insurance operates, because insurance wants you to pay whether you're going to be sick or you're not sick. So that those who fall sick will now be taken care of with the money that everybody has paid. But if people come when they are sick, which is the likely thing, as I've just mentioned it now, someone will not go ahead and pay for the year because it doesn't look like he's sick this year. Then the moment he falls sick, he say, where is this thing? Let me go and pay 38,000 naira so that I'll go and consume 200,000 naira worth of service. No, that's not the idea. You need to just keep paying, whether you're falling sick or not. You never know when it will happen. And then if you're paying and you're not falling sick, just keep paying. It's protection. That's called insurance, And then you're also helping people who
don't have the
Yes,
resources, the financial resources. Well,
and it's mandatory today. So they're pushing for enforcement.
Okay.
Health insurance is mandatory. The only people that will be left out are those who are considered poor and vulnerable, and it's government's responsibility.
Okay.
So government is to cover them. Today, there are efforts to cover maternal and child health, just to make sure that women are not dying from childbirth and so on, and under 5 children are also not dying. A lot of things are going on covering. There's free cesarean section.
Really?
Yes, covered by the federal government.
That's interesting to hear.
Yes.
Well, Dr. Angus, this is where we'd have to bring today's package to a close. But the topic for today has been a very interesting one. Unverified online health advice versus unlicensed drug vendors, the growing risk of self-medication in Nigeria. As a parting shot, what will be a final word to everyone who's listening?
Okay. Just to say, you wouldn't close your eyes for someone to give you, I'm going to give you something to eat. And you close your eyes. You don't want to see what they're giving to you. You don't want to know what is in there. Same way, when you go to do those mixes, you don't know what you're taking. You're taking from people you shouldn't trust. And so you should avoid those. You can only go to chemists to get what you consider over-the-counter drugs. If you don't know, like today with AI, please just say, what are over-the-counter drugs in Nigeria? You will get a response.
Information.
Seriously. So you get it. Then we'll also talk to regulators to ensure that they try and enforce. And because NAFDAC is doing a good job. So all those that are involved in regulation, they should do more to keep Nigeria safe, because I think that's it, because some of these behaviors are driven by economic forces. You need to use the stick,
And what would you say to Rohai for bringing us here today?
You're doing a fantastic job, and I'll say keep it up. It's more than one word.
Thank you very much.
Keep it up, and then push and let people know about this health insurance opportunity.
Indeed. We'll come back and revisit that topic so we can put all the information there. Thank you for your clear, practical guidance to help us protect our health and our families. For more information, you can actually visit www.rohai.org. That is www.rohai.org. And you get all the information that you need if you need healthcare support or more information. Until same time next week, have yourselves a pleasant day. Bye for now.
Across our communities, myths, stigma, and misinformation continue to affect the health decisions people make every day. That is why Reach Out Health Awareness Foundation, ROHAI, brings you Health Connect Forum, a public health education program created to inform, empower, and promote healthier communities through accurate and practical health conversations. From mental health and maternal care to disease prevention and community well-being, Health Connect Forum brings experts and communities together to address the issues that matter. ROHAI invites health partners, organizations, corporate bodies, and individuals to join this movement through sponsorship, collaboration, and participation. For more information, visit www.rohai.org, call 0703 044 8318 or 0813 973 0664. Health Connect Forum, powered by ROHAI.